Women Who Deliver Vaccines. As you can imagine, our mistress of ceremonies is one of the founders of this collective, 143 women from 38 countries who came together. And I would suggest perhaps to start with an explanation of who are the members of the collective. Charlotte, over to you.
Thank you very much, and warm welcome once again, everyone, to this special session organized by the collective of women who deliver vaccines. 143 women from 38 countries who came together from all levels of the health system, who are involved in every stage of immunization service delivery, to share their challenges, to see how they can support one another, to ensure that those who need vaccines get them. So we are women from all levels. Many of them are here in the room, and you'll get to hear from them in a very short while. But remember, during Teach to Reach Connect 5 on the 4th of March 2022, we had an event to honor women who deliver vaccines in celebration of the International Women's Day. And afterwards, today we want to find out, since hearing from experiences on what people are doing to handle gender barriers to immunization, what have you been doing? And I'm glad to announce that so many men responded to our call, and they are doing so many things. So today we'll also get to hear from them. And I also want to recognize that before today's session, this one is actually the third event in a series of 3 that we organized with the Zero Dose Community of Practice around that works around strategic priority 3, that is coverage and equity. So the first 2 webinars were on social and structural barriers to immunization. This one today is purely experience sharing. Thank you, Reda, and over.
Thank you, Charlotte. And so we'll have the session will be split into 2 parts. One is we'll be turning to members of the Women Who Deliver Vaccines collective. And if you are a woman who works in vaccination, then you can consider yourself a member of the collective, as is starting today. If you have not already joined, there's, of course, the group of founders that Charlotte referred to. And we're looking to really your personal story as a woman working in immunization. You can see a number of questions here. I'll be pasting them into the chat in case you're on your phone or if it's difficult for any reason. And then the second half of the session will be looking to men and women. And as Charlotte said, we were impressed by the number of men who work in immunization who responded to express their solidarity, to share the invitation to this event, and to really want to express their willingness to contribute and help work hand in hand with women who deliver vaccines to make a difference. So Charlotte, let's start. Let's dive in. Who will be the first woman who delivers vaccines to share her story as a woman working in immunization?
Thank you very much, Reda. So I'm calling on the women who are in the room right now. If you are able to unmute yourself to respond to the questions on the screen in terms of what you have been doing as a woman who delivers vaccines. And just to say that I myself, I would like to speak a little bit because I am part of the collective of women who deliver vaccine. And I may not answer the questions directly as they are on the screen, but what I'd like to say is since the 4th of March, we have been getting more and more talk about around how women can get involved in immunization, how their place is indispensable if we are going to succeed and achieve immunization goals, especially when it comes to reaching the goals of IA 2030. And facing professional challenges as a woman, of course, yes, in my days of working in the immunization program in my country, I regularly attended meetings where I was the only woman, and we actually started a kind of talk in which we were saying, okay, we want to put forward promotion of gender equity and gender equality when people are convened for workshops and meetings. there should be some factors that ensure that at least 30 to 40% should be women and 60% the men. But I'm glad that more and more we are getting more women involved, not only on the front line, that is as vaccinators, as community health workers, but also at the level of decision making. But our cry as women who deliver vaccine is that we should get more voices, even women participating in our events, like is the case today. So right now, I'm going to turn towards.
And Charlotte, that's true. In a way, as mistress of ceremonies, in a way, it's unfair that you do not usually share your personal story. So I'm glad, or yes, I respond to the questions yourself. So I'm glad that you did here, as you are first and foremost an immunization professional. So we have the first woman who delivers vaccines, Sifiwe, who is who has unmuted. I'm going to put the questions back on screen. So Sifiwe, a warm welcome to you. Can you briefly introduce yourself, and then we'll go through the questions together.
Hello, how are you?
All right, wonderful, and wonderful to hear your voice. So you can see here, are you able to see the questions on your screen, and are you ready to? Yes. Okay, over to you then. The floor is yours.
All right, my name is Sifiwe Mrepa. I'm from Zimbabwe. I work as a health promotion officer in Umzingwane district. But since the special event on the 4th of March, I was at the provincial office, so I was working actually covering the whole province of Matabeleland South. So during that time, actually, we had I had shared my challenge, or shared the situation that was there in one of the districts in my province. Actually, the issues that we're having is that we're having women that really wanted to get their children vaccinated, but because of the religion that they're into, the men or the leaders of the church did not allow them to get their children vaccinated. So actually, the breakthrough that we had is, after we had done a lot of advocacy meetings with the church leadership, they would put an excuse that it's the women that we're not coming for. Yet they will not allow us actually to get to have an audience with the women. So later we decided, we opened a new clinic around the village that most of the objectors actually stay. And when the clinic opened, they actually enrolled some of the women to work at the clinic. And those actually became our advocate for us, because they knew they were from the same religion. So when they went back to their community and they started to relate how health services were good for them and everything, women started to come to the health facility, though nicodemously, because they are not allowed in their religion to get their children vaccinated. So, but we have had a breakthrough of women coming through to get their children vaccinated, and even them accessing healthcare such as family planning services. So it has really been a breakthrough for us. Yes, we are still advocating with the church leaders, but we know secretly that there are other women that are already accessing healthcare, and that part is important for us. And looking at the current, we're facing a new an outbreak, measles outbreak, and as Mat South, we're actually worried though, even though the outbreak is still very far from us in Manicaland, in the eastern highlands of Zimbabwe, but we are also preparing with giving them information how they can actually get their children vaccinated to prevent the measles reaching to their children. So it really has been a great experience when you see women that are now sort of empowered to actually go and look for services for themselves. So I would encourage other women in the immunization that, when you do a one-on-one dialogues with these women, you actually realize they really want those services, but there are other barriers, maybe that can be social, that may be hindering them from coming for services. But when you really talk to them, you actually find out that they're really in need of these services. So we continue dialoguing with the church leaders, but it's really been slow in that area, but we'll still continue so that at the end of the day, they don't come secretly. We hope we'll have that breakthrough soon. Yeah, thank you. I don't know if I answered most of the questions.
Thank you very much indeed, Sifiwe. Wonderful to hear your story. Now, with us in the room are those we call the guides on the side. And there are partners from the Zero Dose community of practice, as well as gender specialists from different international partners. We're going to introduce them in a little bit. They are Shubo Rashid Jalal Ruzbani, and I believe at least one other person supposed to join, but we'll go to Shubo after hearing several of the stories that are being shared, first by women who deliver vaccines, and then by women and men who are interested, who will share stories of overcoming gender barriers. Back to our mistress of ceremonies.
Thank you, Reda. I'd like to invite Boma Otobo. Boma, your hand is raised. You're one of the founding members of the Women Who Deliver Vaccines Collective. Over to you.
Hello, everyone, and thanks, Charlotte and Reda, for this wonderful opportunity, if I may call it so. My name is Boma Otobo, and I worked with the National Primary Healthcare Development Agency in Abuja at the national level, where we are strategically in charge of immunization, looking at women who deliver vaccines. I will count myself lucky because I never thought this opportunity would come, but the way I have found it, I have taken the bull by the horns, and I'm sure other women like me are also making great strides to ensure that at the end of the day, we get what we want. Yeah, so taking a look at the topic today, what has changed for me since March the 4th? Yes, I would say quite a lot. The experience of being with the Geneva Learning Foundation is something I cherish so much. And we all know the goals of the IA 2030, which is a vision of a world where everyone at every age fully benefits from vaccination for good health and well-being. So even looking at that goal, I take it as something personal to me. Vaccines are they are life-saving, and they are very effective, and they are not as costly as treating the disease, so to say. So when you look at this vision, it gives me a push, and I'm so glad that I'm aligned with what the Geneva Learning Foundation is doing. Now, the second question is talking about the role of women in leading the 2013 IA movement towards its goals. Yes, we have seen the goal. And for me as a woman, I see myself as a goal-getter. I know that once you set a goal before me as a woman, just like I do even on the home front, I will not stop working until that goal is achieved. So you can see that women play a very vital role. Women are the caregivers, the primary caregivers. So for us to make up our minds that we want our children and others to benefit from immunization, then that's something good and great for the community as well. So women are leading, and women are definitely making their voices heard wherever they are. What can men do? Of course, men can encourage, in as much as also showing the way to go. So they can encourage, they can stand by us as women to ensure that whatever goals are set, we all achieve as one, so to say. Have you also had any professional challenges as a woman? I will say several. I have had several challenges. One that touches me most is when men or other people consider me as a weak link, so to say. And so you find that when we get to carry out a program and I'm deliberately sidelined because of my gender, I then take it on me that I need to prove myself that being a woman is not a curse. Instead, it is a plus. Because at the end of the day, I find even the men folks coming to tell me that I have done very well in keeping everybody together. It's like when you put cement in on the floor and you leave it and go and come back, it becomes hardened. That is the role of a woman in a team. The woman ensures that everyone achieves. So as much as possible, I have also tried to gain knowledge, because that's one thing that I would not want anyone to fault me about, telling me because I'm a woman, I do not know what I'm doing. No, I would rather want to teach them and train them, because I have gone ahead to learn and to make sure that I actually am getting more from what I'm being taught. Now, what will be my message to women? I want to encourage every one of us. We are not here by accident. I'm talking about the Geneva Learning Foundation. We have come here specifically to learn how women can lead. I like when men lead, but I like it better when women lead, because at the end of the day, the woman will not give up until she achieves success. So I want to wish everyone who is a woman here today, please take the bull by the horns wherever you are. Ensure that success is gotten. I want to say this again. I like working with the traditional institutions. Wherever I go, I try to identify who these gatekeepers are, and I make my presence known to them. And I ensure that at the end of the day, if I have issues, challenges, I always run to them. And once they speak, everybody goes in, to do what they've asked that we should do. So I like to leave it at this point and to wish everyone here success in what we do. Over. Thank you.
Thank you very much, for that inspiring and motivating experience that has been shared. Right now, we'll listen to one more before we turn to the guides on the side. Because I have Lucy Kanja that has been waiting for quite a while.
Yeah, greetings from Kenya. I'm Lucy Kanja, Vaccines and Immunization Consultant, working with UNICEF and currently supporting Ministry of Health, National Vaccines and Immunization Program. I've been a member of Geneva Learning Foundation for quite a while. And every time I join in, I learn new information, and therefore a great platform for us to learn. Now on the questions of the day, what has changed since I joined the special event on March, and what am I doing differently? Number one, after learning on the global strategy on leaving no one behind, it was like an eye-opener to me, because now you realize we are not having the only infancy vaccination services. We also have now the adult, and even with COVID-19, new challenges have come on board. And therefore, now I look at immunization program differently. Then question number two, what is the role of women in leading immunization agenda 2030 toward its goal? Looking at the strength of women and their concern for the families, to me is a force to reckon with. And particularly when I look at the priority framework of action of IO 2030, Immunization Agenda 2030, I'm in love with priority number one about primary health care and universal coverage. Also, number three on coverage and equity and outbreaks and emergencies. And why did I choose those three? And also, I'm in supply chain and sustainability. When you look at especially when there is outbreak and emergencies, the women and children are the most vulnerable populations that are affected whenever there are those challenges. And when we have voices of women coming in to support the programs, make sure that their voice is heard. Then on question number two, who are the individuals involved? What gender are they identify with? Number one, when we involve women in health strengthening, you look at all the components of health system strengthening, from leadership and governance, health financing, healthcare workforce, health infrastructure and service delivery, health commodities and vaccines, health information system. When we have those voices in all those components, you find we are able to achieve more, and because we are able also to reach to the last mile. Then what is the role? What is the role or your responsibility in this situation? I was remembering one community that we visited, and we went to give vaccination because we realized they had so many cases of 0 doses, and therefore we felt that most children were missed out. And when we visited that community, we realized that the women were not allowed to give consent for vaccination, and we had to wait up to the weekend when the men are in the community so that they can give permission for those vaccination to continue. And I learned from the engagement that we had with the community, and they allowed the teams to be going there. There was an opening of having door-to-door every second week of the month. And for me, that was a game changer, that somebody was able to put a face on the importance of vaccination, even to a community that had it was a group of people that had refused vaccination. And what are the barriers that we found? The barrier was like now how it had to take us a lot of time to convince the gatekeepers that they can allow their women also to decide on the vaccination services. And how did it end? It was a win-win, because currently the services are ongoing door to door, but over the weekend. So we had to go out of our way, instead of the way people were used to just going Monday to Friday. Now they are able to go out of their way and go over the weekend to make sure that no child is left behind. And what was there anything that surprised us? Yes, because that community is in the city, and we did not expect to have such barriers. Even when people are in the city, we expected that to be in the rural area. But we are glad that now they have accepted, and therefore children are vaccinated. Over.
Thank you very much indeed, Lucy Kanja. The time has come, Charlotte, I believe, to turn to our guides on the side. We have two that are going to introduce themselves when they speak. So Aftab Kawaja and Shubo Rashid Jalal Ruzbani. We're going to start with Aftab and then Shubo. Please, as we ask of all participants in these very short sessions, please be concise, get to the point, focus on really responding in terms of the support that you're able to provide to in response to what you heard. We'll also, if time allows, we'll turn to Deepa Pokharel, who's kindly offered to also share her feedback and insights. So over to you. Let's start with Aftab.
Thank you so much, colleagues. Good morning, good afternoon. It's Dr. Aftab. I'm working with the immunization team based in UNICEF, country of West Islamabad. So coming back to the point, I heard my last two colleagues, Momi and Lucy. And due to connectivity problems, I was not able to join from the start of the session. So I really like these two talks by these colleagues. So as mentioned by Momi, I think the key point was, which I really like, that as a female, we need to follow the results, and we need to be leader at every point, at every point in our life. When women will take the leadership role, they will take us to a kind of success, not only in their professional lives, but in every aspect of our life. Whether being a caregiver at home, at workplace, wherever they are. So that's a kind of critical point. I think it's a kind of basic principle which we need to follow, that as a man, we need to give this role to the our female colleagues at every point, at every aspect in life. And this leadership role, when it's taken by our female colleagues, that will have a huge impact in each and every aspect of the life. Secondly, I also really like this discussion by Lucy. I mean, the key point she made. I mean, that's a kind of real bottleneck, that the decision-making part is not with female. The decision-making part, it's with male at home, who is not at home, who is not taking the responsibility of caregiver at home to kids. I mean, we also observed it's a kind of as a common practice that the decision making is with male, and whenever our teams they are visiting to the community, mother or female caregiver at home, they don't have the power to take the decision whether they need to, whether they can have their child vaccinated or not. So the impact is not only on the female child. This lack of having a decision making authority with our female caregivers, it's also impact the male child at home. She's not able to decide whether she need to get get their male and female child vaccinated or not. So which is definitely contributing to our zero dose children and zero dose communities. So, I mean, if I summarize these two things, number one, we need to advocate to give the leadership role to our female caregivers at all levels, and then the decision making. And this will definitely help to improve the immunization coverage, reduce zero dose children and zero dose communities, and help us to achieve the IA Agenda 2030. So I will stop here and handing over back to my colleagues.
Thank you, Aftab Kawaja. Over to Shubo Rashid Jalal Ruzbani.
Yeah, good morning, good afternoon, colleagues. I'm really pleased to be with you today. I hope you can hear me.
Loud and clear.
Okay, good. So I really want to thank, I'm the Senior Gender Advisor in UNICEF headquarters, and I'm really pleased to hear the stories and join this session. Very interesting and very informative indeed. I want to thank Charlotte, Safeway, Lucy, and Boma for sharing their stories and the inspiring messages that they have actually shared with us. I would like to give you what I heard. I heard we can achieve more by giving the voice of the women and girls in the field, listening to them. I heard men can be effective, men can be obstructive, but men can also achieve more if we engage them. I heard female health workers have a great role in the IA 2030 agenda as implementers, as leaders, as actually the agents of success for such agenda. And we heard how we shouldn't actually look into the female health worker as a weak link, but as an empowered link. And I also heard that let's also look into the gatekeepers and see how we can achieve more. So we can achieve more through this. This is what I got from the different stories that we have heard. And I would like to add also to that is, when you have that resistance by the religious leaders, let's learn from each other. There are some success stories in other countries that we can build on. For example, in Egypt, there was this book that came out from the Coptic Church, advancing the rights of children, and of course it was jointly with the Al-Azhar Muslim community, where they are advocating for the rights, including the rights of health. How can we use those as a push factor to those resistant in that particular community that you were referring to, Safeway, in Zimbabwe? So learning from others, sharing the experience, and I think the empowerment that comes from this kind of connection amongst the countries, the women who deliver vaccine, the professionals in this field, I think this kind of gathering is also an empowerment where you can pose your questions. I have such a problem. How can you help us in doing that? Well, women in leadership. generally, globally, like 70% of health workforce is female, but not as that significant in leadership position. And this is really important. I want to give you an example. I was in Yemen developing communication materials for cholera outbreak. And all those who are engaged in developing the materials, and the materials speak, dear mother, dear lady, dear sister, all the materials having addressed the need for the woman, but all those who are involved in developing those materials are actually men. And this is a concern. I have raised it with the ministry, and the ministry acknowledged that. How can you design a message targeting women by only doing it from behind the desk? You need to go down, you need to listen to them, you need to know what are their concerns. Like Safeway was saying, no woman does not want health for their babies. They want to vaccinate. Once they understand the value of vaccine, they run to vaccinate their children. But it is the choice and the empowerment. So if we are not able to give that positioning, that empowerment for the women at household level, given all the challenges, the domestic work, the fathers do not allow, the cost of taking the child to vaccination, making them more engaged, give us an opportunity to achieve more. I'll stop here. Thank you.
Thank you, Shubo Rashid, Jalal Ruzbani. Charlotte, it sounds to me like you may have a new member of the Women Who Deliver Vaccines Collective. Are you going to invite Shubo to join?
Definitely, Reda. Remember, we say we are women from everywhere, from every level of the health system. And if we need global voices, then Shubo is welcome to join us and to be our global voice.
All right.
My pleasure to join this. I will be humbled to be joining this a great initiative.
Thank you, Shubo. And we do have a third guide on the site. It'd be a loss for our plenary if we did not hear from Deepa Pokharel. Deepa,
Thank you, Reda.
Yes, please. Would love to hear your thoughts, reflections after the three stories, and then your colleagues who've already commented and responded.
Thank you. Thank you so much, Reda. So just on a quick introduction, I think this might be a different audience. My name is Deepa Pokharel, and I'm the Senior Advisor for Social and Behavior Change, but also the team lead for vaccine demand at the global level with UNICEF headquarters. So a lot of these things, what I think the colleagues have commented on the stories, great stories to hear from colleagues, but a couple of things which really sprung to me. One is the empowerment. At what level are we? Are we having women on the table as equal partners when we are developing, whether it's a government level plan or micro plans at the community level? We really need to have equal footing at the table so that real issues come. But we're not saying that gender is just about women. Of course, there has to be an equal voice given to both men and women. The second thing is rather as what can we do to address some of the things that we are seeing in immunization related to gender. There are many practical issues, timing not being very convenient for women. Are we doing something extra to reach to the women, elderly women in the COVID, for example? There have been many experiences of people feeling not comfortable coming for the girls not wanting the HPV vaccine to TT vaccine. So these are just real issues, and the strategies when we develop, as Shubo was saying, how can we develop something without engaging the girls and women themselves? That's very important. But I would also like to say that men have to be engaged, not just as supporting, as decision makers, but also to make sure they are taking care of the children's need in the immunization. It's not just the women's role to get the children vaccinated. It's equally the responsibility of the father, the grandfather. So I think we'll have to look at it in a different way of the women at different levels, all kinds of women that we've heard from, at different levels, from community health workers. We all know that majority of the community health workers are really female, and how do we empower them so they are equipped with not just information but also the peer-to-peer support, the things that they may need in terms of having a proper HR in place. How do you advocate that there needs to be more female in the system? I think we'll have to look at it very holistically, and all these stories from the women are very empowering, starting with our own very Charlotte. So thank you so much.
Thank you very much, Deepa. All right, back to our Mistress of Ceremonies. So this time we're going to go to the second half of the of this plenary. Think of a recent experience when you encountered a gender-related barrier or concern when providing immunization services in your work, and you were able to do something about it. So you're going to tell us again, get very specific, not generalities or your opinion about these issues, but something that actually happened that you were directly involved in. We want to hear your story. Over to you, Charlotte, to tell us who will be our first speaker for this segment.
Thank you very much, Reda, and I'm encouraging our men, our brothers who have stories around resolving gender barriers to immunization. You have the opportunity now to raise your hand, but I'm going to turn towards Dr. Joy Ataudi, whose mic is already open. Joy Ataudi, over to you. Share your story with us.
Thank you very much, Charlotte. Thank you, Reda. Thank you, everyone. Actually, I had an experience during one of our activities. Sorry, my name is Joy Ataudi. I'm a volunteer supervisor, immunization supervisor, and I work in Nigeria. And I'm opportune to work even at the national level, but I get sent to supervise immunization activities even at the community levels too. So one time during an activity, we were immunizing children, and we got to this particular house where the young mother, who was about 19 years old, insisted that she would not give her children release her children to be immunized. And that was simply because her husband had not permitted her husband had not given her the permission to release her children for immunization. So and her husband was not at home at the time for me to ask to get permission. So I was able to educate her and I asked her, and she said, look, do not waste your time because I will not release these children until my husband has agreed. She herself said that she knew the importance of the immunization and that she was willing, but until her husband gives the go ahead, she will not do that. So I took the time to trace her husband, and we were able finally to trace her husband, and I got him. After much begging, cajoling, explaining and all, we got him to grant the permission, not just for that particular round of immunizations, but for subsequent ones. And what was really important, what was really a big win for me was being able to enlist him as one of the people to help even convince other men in the community to give such express permissions to their wives, even when they were not at home. Thank you. That's my story. So the other question is about what happened. The main, okay, I had said what happened, and the people involved.
Yeah, Joy, I think
can you hear me?
I think you covered it all. I'm looking to Charlotte.
Yeah.
Thank you. Yes.
Thank you so much.
If you could just tell us, is there anything that surprised you?
Yeah, my surprise was that even though I expected that, well, she understood the importance of immunization and she was willing. But the fact that she said that even if she herself got sick, that she would not go to seek help until her husband was able to take her. So that's really surprised me, and that got us thinking as to what to do to begin to look at the root cause of such things and see how we can tackle that. Thank you
very much. Thank you so much for joining. I would like to, Emmanuel Katubwa, your mic is already open. So you are the first man to share your experience in this particular plenary. Please go ahead and do not forget to introduce yourself.
Yeah, thank you, Reda. Thank you, Charlotte. Yeah, and Reda and every other person. Good afternoon, good morning, good evening. I am Katubwa Emmanuel. I work with the WHO in Nigeria, Yobe State, and I am an immunization expert, now reassigned to surveillance activities in the country. The situation I'm going to describe now happened while I was in my former station in Adamawa State of Nigeria. I actually went to a health facility to do some routine immunization, supportive supervision. And yeah, fair enough, the health worker there was a female, is a female, and at the end of all the, the filling of the checklist, on the ODK, you go out to carry out this community survey, just to see the status of immunization in that community where the health facility is located. And I went out and I started my survey and came to this house where I saw 2 eligible children on the one children. Actually, they were just about a month old. They were twins. And I looked at the immunization cards and I saw that these are 0-dose children. They didn't have immunization cards. And I asked the woman, what happened that your children are not immunized? And well, she said, well, she didn't give birth to them here. She gave birth to them in another place, and they came here to, to where the parents are. I said, okay, but in this area, there is a facility and they offer immunization services. And she said, well, she cannot go out until 40 days after the birth of these children. Wow, that was actually the gender-related barrier. And the good thing is that, of course, she believed in immunization, but because of this barrier, okay, she just took everything for granted and didn't really bother, asking where such services could be gotten. Fair enough, there was her younger sister in the house who was, old enough, to carry these children to the health facility. So I asked, I said, now, this lady by your side, who is she? She said, she's my sister. I said, good. If you can't go out within 40 days of the birth of these children, your sister, okay, could carry these children to the health facility where they could be immunized. She said, oh, that's true. I said, fine, if there's no problem, why not? Let her come along. We will take the children to the health facility for vaccination. Good enough, there is this daily immunization going on in some health facilities in Nigeria. So that was how we took those children to the facility and they were immunized. And I told the female health worker, I said, look, you don't seem to have any problem in this community. It's like a lot of your clients are very compliant, but look at even within, this high acceptance level, we're getting we're getting some 0-dose children in your settlement. That means you need to do a lot more to try and capture this kind of children in your community. And it turned out very well that, well, those children got immunized even without the woman coming out. So nothing much surprised me. It's just that the environment was a very compliant community. She just happened to be found in that community, and good enough during this community survey, we found her out and we were able to immunize her. Another thing I'll also advise is that women should always talk to their fellow women in communities, if the awareness is high. I guess one of the women, one of her neighbors in that area should have, ab initio, encourage her to, or encourage these children to be immunized, just like we did. Thank you, and over, Charlotte.
Okay, thank you so much, Emmanuel Katugwa, for sharing this experience. I would like now to turn to, we have so many hands raised and so little time. So I'd like to turn directly towards Carolina Kosile. Carolina, are you able to unmute yourself?
Yes, please.
Please,
yeah.
go ahead.
Good day, everyone. I'm very happy to be on this call. My name is Caroline Nakoshile, Communication for Development Specialist. I worked for UNICEF Nigeria at a regional level in Lagos and Accra office in Nigeria. And basically the questions today, the first question talks about a situation that happened that is mainly gender related. Well, it was during an immunization session in Jigawa State, house to house, and we got to a house with a child, a zero-dose baby, and it was on supervision and it was reported. So we saw the issue as a gender barrier, decision making, and the norms and culture related. But the mother of the baby said she had to wait for her husband, just like a colleague has said before. So we waited for her husband to come back, but he refused. But we had to also talk to the gatekeeper of that community. He was the one who now convinced the man, and the child was vaccinated. Ordinarily, the woman of the house does not have the power to make decisions on her own on the son's health because of different rules that are dictated by the society, gender norms and values. So there was this also the issue of lack of education, because if the woman was really educated and informed about the survival and health of her baby, I'm sure she would have found a way to say, okay, maybe the baby should be immunized, or talk to the husband, or go to the gatekeeper in the community who we saw that really supported immunization. So what happened that day was really gender related, and it's a barrier. And the issue in that community is the one that speaks to power relations, whereby the male, the husband, wields more power due to tradition, due to culture and norms. So the woman lacks decision-making autonomy. She cannot make any decision without the husband. And the woman also is illiterate. She doesn't work. Even if she wants to take the child to the clinic, she doesn't have the money for transportation. So here comes inequity and inequality with the man. So who were the individuals involved, and what gender do they identify with? The individual involved are the young mother, whose power in society as a woman was little because of her gender, and a man, her husband, who is a decision maker. And the last person involved was the innocent child, that boy, the zero-dose boys, who was in the middle of this decision making between the man and the woman. And then our role that time was facilitating as government partner, as development partner, and as a supervisor during the immunization days. And then our role was also to make sure that every eligible child was immunized in that place, and despite the power situation on the ground. Then the fifth question talks about what did we do? Well, we spoke to the person that had the power of decision making, who was the father of the child, and also the gatekeeper of the community, who we were lucky to be on our side. So he persuaded the father, and then also made sure that all the children in that community henceforth were actually vaccinated. It went out well. It turned out very well because the children were now immunized. Then was there anything that actually surprised me? Not really, because gender inequity in health occurs between men and women in some parts of the world, not just only Nigeria. Men are supposed to be the decision makers, and this poses barriers for women and girls to access health information, and they can't make decisions, and they also have limited access to finances. Also, education is a problem because they have literacy level that's very low. So basically, the woman, if she was educated, she would have known that it's good for her to educate her child. Thank you very much, Reda and Charlotte and all our facilitators. I'm very happy to be on this. cause.
Thank you very much
Thank
indeed.
you very much.
Now the time of is cruel because we have 5 minutes for our final speaker, and then we will have 90 seconds each for for two of our guides on the side, Aftab Kawaja and Shubo Rashid Jalal Ruzbani, to share their final thoughts before we close this plenary. Charlotte, over to you.
I'd like to invite Matthew Joker Matthew from South Sudan. Are you able to unmute yourself?
Thank you very much for this opportunity. I'm called Matthew Joker. I'm from South Sudan. I work for WHO. I started work as EPI from 2000 until now. The situation that I went through was during the polio campaigns. There are a lot of situations that we went through, but one of the situations that actually I was very impressed and I was really happy was one of the during one of the campaign, one village, the whole village refused to take polio vaccines. So we mobilized ourselves at the state level with all the stakeholders, including the council director, and we invited the chiefs, the women group, and the youth group, and all the members to come for the meeting. So during the meeting, the whole mothers refused that. They are the people who suffered with their children and they cannot actually give their children for immunization. They don't want, because this polio is a vaccine that is going to stop them from producing. So they don't want they don't want their children to be vaccinated. So they continued, because I don't know the dialects. So I was there was a time that I was given time to speak. The first question that I ask you now, you have the right because it's your child, but I have a question. Why do you allow yourself to conceive and you stay with a child in your womb for 9 months, suffering with your child, until you deliver the child, and now you abandon your child to the disease that can be prevented? That's number one question. Number two question I ask the chief. If suppose we came with 10 children crippled and one child that is well immunized and healthy, which of the two you will take? All of them say they will take the one child. I say, why? The 10 are more, and this one is only one. Why are you wanting to take only one child? They say, because this is healthy now. I say, okay, if that is the reason, now you have to immunize your children so that your children may become healthy like this one child that all of you agree to take. So from that meeting, the chief, the women group, and the youth group leaders, they all agree, okay, now if that is the situation, from today, they wanted all the children in that village to be immunized. And the chief has to give orders that from tomorrow, let the vaccine be brought, and I have to be there so that I have to witness that all the children are immunized in that village. And that was the first time that the village was fully vaccinated. All children were vaccinated by that day. And that was when I became very happy. And in immunization, we have to make sure that we involve all the stakeholders. For example, the chiefs, the women group, the youth group, and other stakeholders, so that we can give them the real message about the immunization and about the disease itself, so that they can understand. After understanding, they are the one to take decision, because they own their children, but we have to tell them the difference, the burden of the disease, and the benefit of taking vaccines. I think I will not take time. That's what I have. Thank you so much, and thank you for giving me this opportunity.
Thank you very much indeed. We're now going to give, and this feels really unfair. We're going to give 90 seconds to Aftab and Shubo, 90 seconds each to share their final parting thoughts. And I hope that this is only a stepping stone to the kind of dialogue between global and local partners, between global and local practitioners that we'll be able to imagine and then make happen together. We started with Aftab last time, so let's start with Shubo and then Aftab.
Yeah, thank you very much, Reda, and thank you very much, colleagues Matthew, Emmanuel, Jaya, and yeah. So thank you very much for sharing those experiences. Two things that came out for me. One is the importance of gender analysis, because it is the root causes. We are sitting behind the desk and we're planning our immunization team, but planning, and we do wonderful outreach. But then if we do not understand what is it exactly the basic barrier at the household level, we will not be able to solve the problem. So gender analysis is a key message that I want to pass through the session. And it is really important in the planning stage, in the implementation stage, and in the monitoring stage. That's number one. Second, because you heard all the stories, her husband doesn't accept, the religious don't accept, the cultural norm is that. So we need to know those to be able to say, yes, our vaccination will succeed or not. The second thing is the investment in local solutions. So the example from engaging one father that has actually led to engaging other fathers in the community. It's an investment, a cost-effective investment. The engagement of women groups in the example that Matthew shared with us is a simple way of addressing a big issue. The example that Dr. Emmanuel has shared with us is, look at that, very simple answer, very simple solution. Let the sister take the child. So he did not challenge the norms. He actually addressed them and accommodated them. So simple solutions, investment in local solution are really important aspect that we need. These are the things I heard. I want to add one important aspect, which from my side, the capacity of health worker in convincing, the communication skills of the health workers in convincing. How do you convince a father that is rejecting because of religious leaders? How do you convince a father who is rejecting because he read this article on the internet that immunization causes autism? How can you convince? That communication skills, convincing strategies is really an important empowerment component that I would add to every training component for health workers. Thank you.
Thank you very much, Shubo Rashid Jalal Ruzbani. A final word from Aftab, and it'll have to be much shorter than your colleagues.
Stop here.
Thank you so much, colleagues, and thank you so much, Emmanuel, Carolina, and Matthews. When I was listening, it seems that I'm directly interacting with at household level with mother. It's not that I'm listening, colleagues, and thank you so much for really sharing your experience from the ground. So, in summary, I will bring another aspect of our immunization service delivery, and it's the immunization system, resilient immunization system, system strengthening aspect. I mean, colleagues have witnessed and shared the bottlenecks identified at household level, which relates both to the supply side of the system and demand side of the system, by caregivers and by our supply side. So how now these bottlenecks have been identified? Our colleagues have taken a kind of exceptional corrective measures on ground. But what I was asking myself, so whether we have that resilient immunization system where gender sensitive, all these gender sensitive strategies are being implemented to have this a kind of long-term solution, long-term local solution, as Shabo mentioned, of all these bottlenecks. So what I will suggest that we need to have a kind of, we need to establish those community platforms at community level, where we need to empower the communities to access these services more effectively. A second is the missed opportunity. I mean, we need to consider those missed opportunities and like these deliveries at maternity home, vaccination at maternity home, outreaches, and empower our female caregivers and workers to address these issues.
Thank you, Aftab.